ในช่วงต่อไปครับเป็นอีก2ช่วงสำคัญก่อนที่เราจะรับประทานอาหารกลางวันนะครับแล้วก็ในช่วงบ่ายที่จะมีการประชุมห้องย่อยด้วยนะครับในเวลา 13 นาฬิกาตรงขออนุญาตที่จะพาแขกผู้เกียรติทุกท่านเข้าสู่ช่วงสำคัญนะครับการอัปเดตสถานการณ์นโยบายโลกว่าด้วยการดื้อยาต้านจุลชีพนะครับในช่วงนี้ผมขออนุญาตที่จะเรียนเชิญวิทยากรทั้ง3ท่านนะครับ Welcome all participants to update AMR World Policy Sessions. May I invite Dr. Richard Brown, Program Manager Health Emergency and AMR WHO Thailand, and Dr. Mary Joy Gordon-Sillo, Regional AMR Surveillance Coordinator, and Ms. Maria Judith Sabian, Monitoring and Evaluation Communication Project Officer.
Good morning, everyone. As you've heard, I'm Dr. Rick Brown. I am the program manager that covers antimicrobial resistance in WHO Thailand. And I will maybe ask my colleagues to introduce themselves when they're going to give their presentations. We were given 30 minutes, and we all thought it was important that we should have equal time to present the work that our organizations are doing, which is really in keeping with the spirit of this tripartite organization and a reflection of the way we work together in an atmosphere of collaboration and, I guess, mutual respect. So I'm giving the first presentation, so I will start. Should say, while I'm waiting, also thanks very much for being provided with an opportunity to provide these updates. So do we have our presentation? Can we have the presentation from WHO? It's the one that has the blue slide at the beginning. Okay, so what I'm going to do is provide really a global overview that applies equally to both the animal and human health sectors rather than focus on the work of WHO. So maybe I can have the first slide. So as you've heard already, people are now talking about antimicrobial resistance as possibly the greatest threat to modern medicine that we're facing. And our relatively new Director General, Dr. Tedros, has taken up this theme and this message, saying that antibiotic resistance is a global health crisis that should be addressed with the utmost urgency. Can I have the next slide? This slide is showing graphically something that you all know, which is about the importance of the timeline on antibiotic discovery and the development of resistance. So what you see underneath the line is the date of the discovery or development of different classes of antibiotics represented by different colors. And above the line is the date at which resistance developed. So you can see for most of these, it happened relatively quickly. But also, as the orange circle is showing, it's 30 years since a new major class of antibiotics was last discovered. So this is the problem we're facing. When you hear talking about the antibiotic pipeline, the tools that we already have are at risk of becoming less useful because of the development of resistance, and we don't have much in the way of new antibiotics coming. And also, we're all talking and thinking about the progress towards achieving the Sustainable Development Goals. So this is not just about human health, it's about development in general. But there is a link between AMR and many of the different SDGs. So the first SDG, we know that antimicrobial resistance probably has its big impact on the poor. The rate of resistance in people less well off who are being treated is high. And there are also problems with the cost of medicine and access to care, and also sometimes poor measures to prevent infection. And then for SDG 2, we're seeing untreatable infections in animals, which potentially threatens sustainable food production. And then for SDG 3, the ability to treat infections is a fundamental component of all health systems. And then for SDG 6, we are also concerned about the contamination to water of antibiotic residues, not just water, but the environment, obviously. Antibiotic residues when antibiotics are disposed of, both from hospitals but also in agricultural practice. And then for SDG 8, the financial burden of AMR, if we don't take good action, is predicted to be huge by 2050. Also, it's crucial to balance access, innovation and conservation of antimicrobials to contain AMR. And lastly, for SDG 7, as you've heard and as reflected by the incredibly impressive broad participation in this meeting, which also reflects the commitment of Thailand, we require multiple partnerships of different stakeholders to tackle this problem. Now, this slide is it's not directly about antimicrobial resistance, but what it is showing is for different countries, the estimated burden of infectious diseases measured by daily adjusted life years against the gross domestic product of those countries. So what it's essentially showing is that there is a tendency for the countries with the biggest burden of infectious diseases to be the poorest countries. And this has implications for treatment of infectious diseases, but also the development of antimicrobial resistance. In fact, what it's showing is really that Africa faces one of the biggest challenges if we're talking about the different regions. And more specifically about the financial resources that are directed towards healthcare, we know that there are big differences between countries. So again, this is the same information but more specific to health. Some of the countries with the biggest burden are directing lesser resources towards to healthcare programs in general. But the other point about this this slide is actually about the we go back. Yeah, is actually no, the slide before still. Yeah, what it's showing in the difference between government and expenditure and total expenditure is actually the out-of-pocket costs. So a lot of the burden of healthcare in many countries is falling to members of the public. And I think this is an additional problem when we're thinking about tackling AMR. So next slide. And then to compound the problem, the workforce that's available in different countries also is very different according to where you are. And it's encouraging to see that there are lots of pharmacists as well as doctors. So this is talking about human health, obviously. But again, for some countries, this is going to represent a real challenge. Next slide, please. So to help to take this issue on in a practical way, this global action plan was developed. And of course, not just by WHO, but also by all concerned UN agencies in collaboration with partners and with technical input from all the relevant experts. And the components of this action plan, at least the strategic objectives I will read out, it's firstly to improve awareness and understanding. Secondly, to strengthen knowledge through surveillance and research. Thirdly, to reduce the incidence of infection. Then to optimize the use of antimicrobial medicines, and also to ensure sustainable investment in research and development. The Global Action Plan also embraced a number of guiding principles, which I think are actually very, very important. The first is whole of society engagement, including the One Health approach, which we will be hearing more of. But this is reflecting the complexity and the scope of the problem, and the fact that it affects all people. So it can only be tackled with the participation of all societies, including obviously members of the public. It also puts a strong emphasis on prevention, including good sanitation, hygiene, infection prevention and control practices, but also, for example, better use of vaccines. If you can prevent someone from getting an infection, then they won't need to be treated. It also places an emphasis on appropriate access. So this is partly about preserving the ability to prevent and treat infections when they present. It also interestingly acknowledges that there are some bacterial infections that are undertreated. So this is not necessarily about decreasing the number of antibiotics used for all conditions. It's about ensuring that the way that they are used is appropriate and that people take on the full responsibility when they're dispensing antibiotics. Then next, sustainability. So as you heard already from Admiral Narong, all countries were to have a national plan with a defined budget within 2 years of the endorsement of the GAP plan. And lastly, incremental targets for implementation. So this is acknowledging that, that tackling this problem means very different things according to the country in which you're residing, and that for some countries it will be very, very challenging. They need to set their own agenda, their own timelines to attain these goals. And as you will hear more, as you've heard already, we very much embrace this One Health approach. And this is a reflection that AMR affects humans, animals, plants, and also the environment. And so WHO has for several years partnered with FAO and OIE in particular to adopt a comprehensive approach. And we're also starting to collaborate with UNEP, which is the United Nations Environment Programme, to develop evidence base for AMR impact on the environment. So it's interesting, we're starting to do that, but in Thailand this is something you've already taken on board. You're in some respects a little bit ahead of us. So this slide is showing a snapshot of the state of development of national action plans. So the red color is representing countries where a lot of work needs to be done. And in fact, the green is representing countries that have a national action plan. And actually, I heard just this morning that in fact Lao PDR does have a plan, but it just hasn't been finally endorsed. So from this perspective, this region is doing relatively well. But of course, development of a national action plan or a strategic plan is only really the starting point. But I do find this somewhat encouraging. So the way forward is covered in these three different areas. For governance and multi-sectoral approach, it is important that we identify the stakeholders in different sectors of government and bring them together. And a key part of this is to have a high-level AMR coordination committee, but also to identify sources of sustainable financing. It's also important to systematically strengthen systems And some of the important components of this are laboratory capacity and also strengthening surveillance, including laboratory surveillance, but also epidemiological surveillance. Then to look carefully at the antimicrobial supply chain and also to monitor and control consumption of antimicrobials. And then also to strengthen infection prevention and control and antimicrobial stewardship programs. And then the last component, awareness raising and health education. You have heard already about the World Antibiotic Awareness Week campaigns. But it's also important that we pay some attention to the health professionals' curriculum and do what we can to raise awareness amongst all stakeholders, but including members of the public, and strengthen advocacy. And I think this is my last slide, but I think what I can reflect on seeing this list is that Thailand is taking action in all these areas. So I really applaud the fantastic work that you're doing. This is really just to end off the presentation. This is just one of the graphics from the World Antibiotic Awareness Week. But with this, I will hand over to Mary Joy Gordon, CEO. Oh, you have who has her own microphone.
So, good morning, everyone, and it's a pleasure to be here, and congratulations for the successful launch of the AMR Action Plan of Thailand. So, if we can now have the slides for FAO. Meanwhile, I would like to introduce myself. I'm Mary Joy Gordon from FAO. I'm the AMR Regional Surveillance Coordinator. So, I specifically work on surveillance in animal health sector. I used to be with OIE, but that's the other presentation. So I think we have to, now just to acknowledge, I think many of you would know me coming from OIE for a while, but I have been shifted to, I worked with our partner, so with FAO, now specifically working on AMR surveillance. So I'll, complementing the presentation from WHO, which we work closely together. So I just would like to share the action plan on the agriculture side. Of course, it cannot be denied that there's a lot of interactions, and there are no boundaries when we talk about antimicrobial resistance, because we live in an interface, So there is a crossover of antimicrobial resistant pathogens, antimicrobial residues, and AMR genes. So all these interact with each other. So from the human health side to environment, to animals, and back to our own soup of AMR setting. And needless to say, given this, if our interest is to protect health, everybody should be working together. From the side of FAO, as a global leader on food and agriculture, following the global action plan of WHO, OIE, and FAO, a specific action plan on AMR that deals specifically on food and agriculture was developed for FAO. Globally, these are the 4 focus areas. 4 focus areas, as mentioned by Rick, is awareness, evidence development, governance, and practices on AMR in the animal health sector, environment, and all those other sectors involving agriculture and food. As you will notice, these 4 focus areas complement very well the global action plans, the global action plan, so that each and every aspect is reinforcing the global action plan. So perhaps just to clarify what are these areas of work, I would like to just proceed. What are we doing in the region? To cite an example, how these focus areas are actually being implemented on the ground. So in the region, we have 3 major work that is being supported by different partners. USAID, we have a project addressing antimicrobial usage in Asia's livestock, aquaculture, and crop production systems. And there's another one from the Fleming Fund, which is funded by the UK government. It's engaging the food and agriculture sectors in sub-Saharan Africa and South and Southeast Asia in the global efforts to combat antimicrobial resistance using a One Health approach. And the last one is the one that is from the headquarters. This is more on fisheries, aquaculture and fisheries, working on strengthening capacities, policies, and national action plans on prudent and responsible use of antimicrobials in fisheries. So these three projects are working together and complementing each other to deliver and make sure that the focus areas are well covered. So for focus area on awareness, and I would like to acknowledge the presence of our communications officer, Dr. Caro. So all the setup that you have seen there this is his area of responsibility. So this is the awareness. So we work on awareness, and as you can see here, Antibiotic Awareness Week is a major area of work. But over and above that, we also have work on, as you know, in the animal health sector, we need a lot of behavioral change. We need a lot of communicating good practices. These are all anchored under the area of awareness. We're trying to develop an animal health sector that is more aware of the complexity and implications of imprudent usage in the animals and agriculture. So aside from that, just to highlight that last Antibiotic Awareness Week, we complement this with good practices, because for this year, the emphasis on good practices. For IPC, or IPC, Infection Prevention and Control, in the animal sector, is good practices, farming practices. So what we thought we'll do is what's going on in the ground. So we had a storytelling contest. So what you will see in our exhibit are actually submission. The one entry from Vietnam won. This contest garnered about 50 stories from the region, showcasing the good practices that has been done and what was its impact on AMR management. So we are thinking of expanding this further, but this is one of the highlights for this year's Antibiotic Awareness Week. And of course, aside from that, there are also the AMR Pledge and Knowledge, Attitudes, and Practices Plus, which are tools for communication. The next area is evidence, where surveillance capacity building is focused on. Maybe you can just click next slide, next click please. So we have this Atlas, which is assessment tool for laboratory assessment, AMR surveillance system and assessment. So this basically assesses laboratories working on AMR and trying to see where are the gaps in AMR surveillance in the animal health sector. We are partnering with Chulalongkorn University, another Thai institution, which is, we're doing these missions with them. Next slide, please. We're also developing tools such as regional AMR surveillance guideline. We have had a review of this just the other day, together with international experts. We also complement this guideline with laboratory training. We're trying to focus on collecting, encouraging countries to gather MIC data, which is quantitative data, not this diffusion data, because for animal health sector, we're trying to monitor trends and changes. So laboratory training, next slide, please, click. We also have pilot AMR surveillance projects and laboratory training in, developing of the regional AMR surveillance framework to explain that AMR surveillance is not just in animals, but also in food animals, but also in sick animals to develop treatment guidelines. Because unlike for humans, we have different species that have different critical clinical breakpoints. We have different species that need different treatment, but we need guidelines for this as well. So it's not just monitoring trends for developing AMR that will impact public health, but also developing treatment guidelines, using surveillance to develop treatment guidelines to encourage good practices in the farm. So basically, these are some of the areas of work. There are much more, but we only have 10 minutes. So next slide, please. So for governance, we work closely with ASEAN and with the SARC, and also, of course, AFCA and other regional bodies. So we help develop multi-sectoral national action plans. There's also strengthening activities on strengthening regulatory frameworks, One Health collaboration. These are some of the projects supported by, for example, the Fleming Fund is working on this. So this week actually is ASEAN Laboratory Directors Forum, or ALDF. They are meeting in Cambodia now. So one of the areas of that is to really level up AMR awareness in these decision-making bodies. For practices, we collaborate with several institutions to gather activities on practices, good practices. We work with Liverpool University for them to document antibiotic usage in the region, with NACA to work on aquaculture, and with IHPP for agriculture. So there are several others, but these are just some of the examples that we are gathering. And the idea is to have evidence-based good practices. We cannot just say that this is a good practice based on theory. So we gather and then have a loop, always have these practices, recommendations to be evidence-based. So there are also AMR initiatives in aquaculture and fisheries, which is covered by the third component of the project, which is headed by the headquarters. So under this, there's an ongoing project that works on antimicrobial resistance and AMR usage in aquaculture and fisheries, including gathering best practices in aquatic animal disease diagnostics and good aquaculture biosecurity practices, identification of the most critical points at different stages of the production cycle for different products, fish products, and how risk can be mitigated in this. And they're also developing a guidance on antimicrobial testing for selected aquaculture products. So this is mainly for fish and aquaculture. So this is just the capsule, the very basic overview, snapshot of what is being done in the food and agriculture sector. There are much more, and of course there are others also working in this area. But just to give you a snapshot that things are also being done on our side, and this is part of the One Health approach in addressing AMR, not only in the region, not only in Thailand, in the region, but globally, that each and every one is important in this issue. So this approach, of course, is a collaborative effort, bringing together expertise from different areas and working together so that we address this rather complex issue. So I think with that, I thank you for your attention.
Yes, Mike.
Okay, so next we have Judith Sablan from OIE.
Thank you, Rick, Dr. Rick. So I'm Judith Sablan, Monitoring and Evaluation Communication Officer of OIE. I'm here to represent Dr. Ronelo Avila, the Sub-Regional Representative for Southeast Asia of OIE. I do not expect many of you know or have heard of OIE. Probably for some of you, this is the first time that you've heard of OIE, or World Organization for Animal Health. So OIE is an intergovernmental organization responsible for improving animal health. It is a recognized reference organization by the World Trade Organization, and as of this year, we have 181 member countries, including Thailand, of course. So as a reference organization of WTO, OIE promotes the responsible and prudent use of antimicrobial agents in terrestrial and aquatic animals so as to preserve their therapeutic efficacy and prolong their use in both animals and humans. And also, OIE produced a wide range of standards and guidelines in this field to provide framework for responsible and prudent use of antimicrobial products in animals and for the surveillance and monitoring of quantities used. Next slide, please. All these guidelines and standards are contained in these two animal health codes, terrestrial animal health code and aquatic animal health code. Specifically in chapters 6.6, 6.7 up to 6.10 in the terrestrial animal health code, and for the aquatics chapters 6.1 up to 6.5. Non-compliance to these standards or guidelines may prevent a country from exporting to other countries and also for importing. Next slide, please. Further, OIE produced guidelines so as to minimize the risk, to address the risk of emergence of antimicrobial resistance in animal food products. particularly this manual of diagnostic tests and vaccine for terrestrial animals in Chapter 3.1. All these standards have been adopted by all 181 member countries of OIE and are regularly reviewed and updated by experts and voted by the member countries. So, OIE also produced a list of antimicrobial agents of veterinary importance in parallel with WHO list on human medicine. So in 2016, the World Assembly of Delegates of OIE directed OIE to compile information on antimicrobial agents, and so OIE produced this annual report on the antimicrobial use in animals. So this is worldwide. And you can, this report is published annually, and the first was published in December 2016, and the second phase will be published by the end of 2017. Data information from this will help member countries to analyze and control the use of antimicrobial agents, and also to obtain more reliable information on import and other relevant information. So, OIE fully supports Global Action Plan on AMR, and from the World Delegates directed OIE to compile all the AMR strategies, and we produce this OIE strategy on AMR with the 4 main objectives: improve awareness and understanding not only of veterinary professionals, but of key stakeholders such as farmers, policymakers, traders, manufacturers of animal products. Second is to strengthen knowledge through surveillance and research, support good governance and capacity building, and encourage implementation of international standards, which I previously mentioned earlier. So, to strengthen understanding awareness on AMR, OIE regularly also produce various campaign materials, and this one is the infographic on AMR strategy containing the 4 strategies. Next slide, please. So we only have limited time, so I would like to invite you all to visit our website for more information, www.oie.int. So you can see from our website the antimicrobial resistance section, where you can find many information on OIE's activities on AMR, and also potential relevant information for the veterinary professionals. So for this, next slide, please. For this, next slide, please. So for this, specifically for this year's celebration of Antimicrobial Awareness Week, OIE produced this video. Yeah, please. this is a general video. If you notice that in the first two portions, there is also a customized video specific for the specific audience, such as farmers, veterinary services, policymakers, manufacturers. So this is available, and if some of your groups would like to use it to encourage your partners, you can just approach me, or I provided this USB to the organizer. So I would just like to emphasize that OIE works in tripartite in collaboration with WHO and FAO in the fight against AMR, because and OIE is committed in improving animal health, and because protecting animals is preserving our future. Kapkan ka.
So I should say both my colleagues have reminded me that I should also, on behalf of WHO, acknowledge the support that we receive from countries for AMR, including the US government, German government, and the government of the United Kingdom through the Fleming Fund. So I just wonder if we're a little bit over time, but is there anyone would like to ask a question or some clarification from us? We'd be very happy to say something now or to talk to you afterwards. If not, I might just take the opportunity, well, maybe to explain. So my role is with WHO Thailand, so it's a country office, but my colleagues here both work for regional offices. So I just wonder if they might like to say something about how Thailand can work to support other countries in the region. I know, as with many countries, tackling AMR is a relatively new problem, and you probably feel that you have a lot of work to do in Thailand. But I think, you are ahead of the game compared to a lot of countries in the region, and I think there are probably already many examples of good practice. I'd also actually should acknowledge the role of two WHO collaborating centers within Thailand. One that's focusing on the development of national action plans and research, and also another one on the laboratory surveillance for AMR. But maybe if my colleagues would like to say something.
I would just like to say that Thailand could be a good example to the other other countries in the region. It could set as example, being with the strong partnership of many agencies. We heard from the Deputy Prime Minister in his opening speech that Thailand is committed to reduce 20 to 30% of AMR use. So I guess that Thailand is a good example to other countries in the region to push for the AMR.
Actually, there are already a lot of ongoing commitments also that we are benefiting from the Thailand contribution to the region. For example, the Chulalongkorn University is one. They're working towards becoming the reference or collaborating center for AMR for the animal health sector, and they're processing that. They're in the process of securing that. That label of being the reference center. And in the process, they're also training a lot of countries already. So just this year, I think we had 3, and next week they will have for aquaculture. So they're already, the resources that's being utilized by the region from Thailand is abundant already. Secondly, there's for the residue. We've just had the international expert visit to BQSF. So they're looking at how the laboratory can be further strengthened to serve as another resource for the region. And of course, we collaborate also, for example, with IHPP. And a lot of bottom line still is the good example that's being set. For example, this national action plan. Perhaps, of course, it's a very good guiding principle for Thailand itself, but over and beyond the country's benefit from this national action plan that is a structured approach, it's also setting the example for other countries to follow. There are a lot of action plans that are developed and drafted, but perhaps the engagement, the multi-sectoral engagement in Thailand, I could say is quite impressive, to be honest, because there really is a very strong interaction, and I think even just preparing for this day, you can see that a lot of people are very active and very involved, and it's really refreshing to see that much energy and very inspiring to work in the region. And wherever we go, sometimes when we talk about this, and we would always say, yeah, you see in Thailand, something like this. So, and a lot of the good practices are also coming here, especially also for the animal health sector. It's a big industry, of course, for Thailand, and we're already capturing a lot of good practices here. So continuing to document these good practices would be excellent example for sharing in the region, because a lot of people are a bit scared to do something different, but if they see that there's a lot of things that are good and that they could emulate, I think that's where Thailand contribution is very strong. Thank you.
Okay, so thank you. And on that positive note, I will thank my fellow panel members and hand you back to our MC. Thank you.
Okay. Thank you very much, our guests of this session. Thanks.